minutes. This time it's my pleasure to introduce our speaker who would share for up to 20 minutes what it was like before ACA, what it's like now, and how the ACA program has helped her. Alison from California's Central Coast has been working her ACA program, I believe, since 2013. That's what I thought. She has selected the topic of PTSD. The floor is yours, Miss Alison.
Thank you, Catherine. And wow, this is amazing. I'm thrilled that so many are here. I think this is going to be a great series and hopefully helpful and beneficial to many. So I'm going to begin by reading. I'm not sure what this is from. Does anybody know? Is this from the Big Red Book? Anyway, it goes like this. ACA's third step typifies our spiritual approach to the disease of family dysfunction. In ACA, we view our compulsive thinking and dependent behavior as a spiritual dilemma rather than a mental illness. We have no quarrel with science and medicine, which have made great strides in mapping and studying the brain. Such clinical work is of great importance in understanding human behavior and brain functions. We freely use such clinical labels as depression, panic disorder, bipolar, dissociation, and post-traumatic stress disorder. Some ACA members have been diagnosed as multiple personalities and as schizophrenic. We do not believe our brains are missing any elements. We start with the premise that we are whole and that we had a normal reaction to an abnormal situation of being raised in a dysfunctional home. Our normal reaction to protect ourselves has created survival traits or compulsions and self-harming behaviors which respond to the ACA steps and spiritual remedies. We are not minimizing the severity of our situation as adult children. The disease of family dysfunction manifests itself in dependency, addiction, and dissociative personalities. The disease can kill. Every day, adult children commit suicide, die in addiction, or die one day at a time in silent isolation, thinking they are hopeless. In ACA, we believe we were born whole and became fragmented in body, mind, and spirit through abandonment and shame. We need help finding a way to return to our miracle state. Whatever mental diagnosis we may have, we seek a higher power in prayer and ACA meetings to relieve our chronic nature of feeling different. We believe God understands the root of mental health labels and freely offers help to those seeking God's love and light. We believe in a spiritual solution for the disease of family dysfunction. I'm going to mute myself for just 1 second. This way I don't need a frog. Okay, hi, I'm Alison, thrilled to be here. I think I already said that. Before I begin, I would just like to remind us all about the principle of confidentiality. Those of us who are going to be speaking, I'll speak for myself. I'm going to be sharing some personal information. It's very important to me that confidentiality is kept. And if you are willing to agree to keep confidentiality and the privacy of the information I'm going to share, please just say yes right now. Yes.
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 Thank you.
Yes.
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 Thank you.
Yes.
Okay. So to begin, in our Big Red Book on page 447, it's the chapter 16 called ACA and Therapy. While therapy is not a replacement for ACA program, many of our members have benefited from counselors who are familiar with ACA or 12-step work. In ACA, we do not practice therapy, but therapy with an informed counselor can be the gateway to unparalleled levels of recovery. Therapy is not a substitute for ACA recovery, which involves focused step work with a sponsor. Many ACA members have experienced remarkable recovery without counseling. The decision to ask for extra help is up to each individual. ACA is a standalone program that offers a proven solution to the disease of family dysfunction. Can everyone hear me okay? Good, okay. Good counseling can help us realize our denial about what happened in our unhealthy homes. Denial and a lack of clarity are the armor that protects sick families from scrutiny. Effective counseling combined with ACA involvement can take years off the time it takes to be free of our old way of life through other methods. The knowledge gained in treatment or counseling can bring greater meaning to recovery in ACA. If we have been stuck or blocked in our program, the extra help usually moves us forward in ACA. The benefits of counseling or treatment can improve our lives. And on the next page, it says informed counseling is a must for clarity and progress. So there you have it. In step 2, which we know to say, we came to believe that a power greater than ourselves could restore us to sanity. Step 2 on page 135 in the big red book, it says, step 2 implies we had sanity and lost it, when in reality, we may be learning about sanity for the first time in ACA. And I feel like I fit into that category. I don't know that I've ever, that I started out saying. So my topic is PTSD. I'm going to talk about PTSD and also complex PTSD, and I'll talk about the similarities. PTSD usually refers to trauma resulting from a single standalone traumatic event, such as an auto accident, a natural disaster, an assault, etc. Complex PTSD is a more severe form of PTSD, typically developing after prolonged trauma, and is more common in those who have experienced repeated, continuous trauma over months or even years. Children exposed to prolonged trauma, particularly from caregivers, are most vulnerable to complex PTSD. What causes complex PTSD? The types of traumatic events that can cause complex PTSD include childhood abuse, neglect or abandonment, ongoing domestic violence or abuse, repeatedly witnessing violence or abuse, forced sex trafficking, torture, kidnapping, or slavery, being a prisoner of war, or living in a war-torn area for a long time. You are more likely to develop complex PTSD if you experience trauma at an early age. The trauma took place over a long period of time. You were alone when the trauma took place. Escape or rescue were unlikely or impossible. You have experienced multiple traumas, or you were harmed by someone close to you. With complex, I'll just shorten it to CPTSD, you experience some symptoms of PTSD along with some additional symptoms, such as difficulty controlling your emotions, feeling very angry or distrustful toward the world, constant feelings of emptiness or hopelessness, feeling as if you were permanently damaged or worthless, feeling as if you are completely different from other people, feeling like nobody can understand what happened to you, avoiding friendships and relationships or finding them very difficult. Often experiencing dissociative symptoms such as depersonalization or derealization. In other words, feeling outside one's own body or that what's happening around them isn't real. Detachment from the trauma. Physical symptoms such as headaches, dizziness, chest pains, and stomach aches. Regular suicidal thoughts or feelings. Unwanted intrusive memories, nightmares, or insomnia. Emotional flashbacks, or what I refer to as triggers, which means re-experiencing feelings that you originally felt during the trauma, such as fear, shame, guilt, sadness, despair, hopelessness, helplessness, paralysis. We react to events in the present as if they are causing these feelings without realizing that we're having a flashback. Talk about physical symptoms already, also panic attacks or anxiety attacks, and hyperarousal or hypervigilance. Some of the symptoms of CPTSD are very similar to those of borderline personality disorder. And the symptoms of borderline are fear of abandonment. And what's interesting, I find, is how familiar all this sounds, because these are the things that we talk about in ACA. Pattern of unstable relationships, unstable sense of self, difficulty regulating urges when feeling strong emotions, which lead to impulsive, often risky behaviors like speeding, suicidal ideation or behaviors, or self-harm such as cutting or burning, frequent and intense changes in emotions, chronic feelings of emptiness, intense anger reactions, and dissociation. All of this can lead to additional issues such as anxiety, depression, and substance abuse. My diagnoses are C-Ptsd, generalized anxiety disorder, depressive disorder with suicidal ideation, not lately, and BPD. I have also experienced drug and alcohol use and dissociation. So, as we like to do, I'm going to start with what my life was like before coming into ACA recovery. On page 131 in the big red book, again, talking about step 2, quote, I had never really known sanity to begin with, unquote. It all started at my birth. I was abandoned at the hospital. My first life experience was abandonment. And I learned the following from this, that the world is not a safe place. My needs will not be met. I am on my own. I cannot trust others to recognize or meet my needs or see or hear me when I have needs. In other words, I was left alone in the nursery, except when I was to be fed. And this lasted for 2 weeks. So the first 2 weeks of my life, I only was with my mother for feeding. She breastfed. I believe that as a result, my mother and I never properly bonded. So I became a convenient scapegoat for her. She wasn't bonded with me, so I could be easily sacrificed at no emotional expense to her. And these are her words. She blamed me for single-handedly ruining her life from day one. She was a narcissist. She was a perfectionist. She is OCD. And there was no pleasing this woman. So I gave up. I craved attachment and affection and attention and love and support, all the normal things a child naturally wants and needs. Yet at the same time, it was not safe to get close to my family members because they were the source of the pain. So I had a dilemma. I wanted them to be close, but it was dangerous to be close. I feared being close. The trauma was my mother and father constantly beat me. My brother was allowed to abuse me with no consequences. My sister was occasionally an ally. I had the 2 siblings, but she could not be counted on consistently. I was left alone. The abandonment part was being left alone at home at night from a young age, like 7. I was made to take the bus everywhere, all over Portland. Oh, I meant to look up what the population of Portland was, but let's say it was, 150, 200,000 people. And we were to get a bus schedule or call up the bus company, find out where the bus went, at what time, and find the bus stop and go catch it by ourselves. And I was a young girl. My parents didn't attend my high school graduation. That made me feel great. My siblings got lavish gifts and attention while I got far less than that. My brother was the favorite. He could do no wrong in their eyes. Consequently, I developed a good number of the symptoms of C-Ptsd and BPD, as I talked about before. I hated myself, and I was sure everyone else hated me too. I did not feel loved at home. I did not feel safe at home. Yet, of course, there was nowhere else to go. I felt ashamed, embarrassed, guilty, and unworthy. I felt worthless. I felt like garbage. I could not get things done. I called it procrastination, but I learned later in therapy. It was my response to being beaten while I was doing chores such as cleaning. So that trauma was really attached to those tasks. I felt overwhelmed. I was terrified. I was afraid of everyone and everything. I was hypervigilant. I did not participate in my life, really. I had no wants or dreams because I learned I was not going to get them. So what's the point in wanting anything if I'm never going to have it? Now, I was introduced to Pete Walker, the author of this book called Complex PTSD from Surviving to Thriving, at an ACA meeting whose subject of study was this particular book. So I came by it rightly through via ACA. Excellent book, hard to read, but boy, it helped me a lot. So he has a chapter called What If I Was Never Hit? He says the outer layer for some is the stark physical evidence of abuse, such as sexual abuse or excessive corporal punishment. He talks about verbal and emotional abuse, and he says verbal and emotional abuse damaged us much more than our physical abuse, which I found remarkable. Hard to believe, but by the way, Pete Walker experienced childhood trauma himself. He became a therapist, so he is helping people with trauma, and I believe he's in 12-step, just because some of the terms that he uses in the book, it's sort of like a tip-off. So he's qualified, in my opinion. Unrelenting criticism is so injurious that it changes the structure of the child's brain. Of course, my mother was nothing if not critical. I made friends easily because I'm so charming, but I was so clingy. I was clingy, so I'm sure that turned some people off and the friendships waned. I was lonely and craved love. When I began dating, I felt loved for the first time. I was 16 years old, but I was attracted to unavailable people, which mirrored wanting a relationship with my family members who were unavailable. I mean, they did not respond to my need or want for love, and they were, to be close to them caused me pain. As an adult, I consistently sought relationships to fill that empty hole where mother's love should be. But the closer they got, the more unsafe I felt, so I pushed them away, my boyfriends. When they went away, because I pushed them, they were suddenly so much more attractive because it matched my home life. That all these people were unavailable, and I really, 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 really wanted a relationship with them. So when they went away, they were so much more attractive, so I wanted them back. So I chased them, and then when they got close, I'd push them away again. It was crazy. And I eventually realized what I really want is a steady boyfriend. I don't want to get engaged. I don't want to get married. That's just too scary, but I don't want to be alone either. I just want to go steady the rest of my life. But no more than that, because it would be too scary. I was volatile, angry, unpleasant to be around, especially toward my family. I was insecure, codependent, needy, clingy, moody, anxious, controlling, immediately assumed ill will on the part of others. And of course, almost all 13 of the 14 laundry list traits. Eventually, my misery was greater than my fear of therapy. My fear of therapy was, we're going to do this digging and find this horrible, ugly, black part of myself that, only 5 minutes left? I thought I started at, okay, you're right. Okay. I started therapy in my 30s and I've been in therapy almost continuously since then. All that therapy helped some, but did not adequately address the root causes of my difficulties. So I ultimately experienced limited success in therapy. What happened? I have one son who's now 49. He severed ties with me in 2007. I was devastated, angry, resentful. A year later, I found Naranon, which is analogous to Al-Anon, but for people with friends and family who use drugs. And I also attended CODA and some AA meetings, and all that was helpful as far as it went. In 2013, I found ACA. On page 135 of the Red Book, it says in step 2, we gain clarity about how our family dysfunction affects us in our lives as adults. We gain clarity about our abandonment and internal shame. Many of us find step 2 sanity through clarity. I gained clarity about, and that's the end of the quote. I gained clarity about the level of abuse I had grown accustomed to coming out of denial. I worked the steps with a sponsor, attended meetings, and took service positions. I found a therapist in 2016 who did EMDR with me. And any of these terms, if you want more information, you can get more information online. I brought her information about ACA. With her, I identified some inner children, and the therapy I did with her while also working my ACA program was much more effective than the therapy I had participated in before ACA. Let's see here, where that is. Okay. Other helpful tools of the ACA program are prayer, higher power, meditation, affirmations, self-care, grief work, journaling, inner loving parent work, all of that, peeling the onion, getting deeper and deeper into the layers, healing the trauma, and of course, stick with it. What it's like now, in step 3, we turn our will and our lives, in other words, everything, over to the higher power of our understanding. I like to use the steps to turn over my self-hate, the doubt, fear, anxiety, depression, C-Ptsd, procrastination, negative self-talk. Now I am no longer alone. I have friends. I have what I call a family of choice, which is some wonderful women that I have met in ACA, because I'm the only one left in my immediate family. I'm more in acceptance now. I'm calmer. I learned from my sponsor, it's all an experiment. That's a really helpful and useful piece of information. I don't permit self-criticism or negative self-talk. I have successful long-term intimate relationships with women. Men, work in progress. I have better boundaries, better self-soothing and emotional regulation. I recognize triggers. I've learned to pause. I have better self-care. I have an inner loving parent who I wrote, she's on call, meaning she comes when I need her and gives me the comfort, love, and support that I need. And I picture myself on her lap, and I'm like, I become 2 years old, and I'm just, she holds me and soothes me. And I have a relationship with my inner family, inner little girls. More self-love, self-acceptance, self-esteem. I'm kinder to myself and others. Less fear of authority figures, less codependent, less people-pleasing. I'm able to ask for what I want and need, and I can ask my higher power for help. Sometimes my prayer is just, help me, help me, help me. And thank you, thank you, thank you. Able to ask for help. I have better boundaries. Have a relationship with a higher power, and I'm attracted to healthier people. I've learned to take care of my own needs instead of expecting others to do so. The promises are coming true in my life, and I'm wrapping up now. On page 28 of the Big Red Book, quote, our experience shows that adult children can change no matter what their dysfunction might be. We have seen miraculous recoveries when the ACA program is worked with willingness and patience. It's the end of that quote. And from page 142, in the Red Book, ACA step work represents a deep well of hope and patience created by a loving God who has given us a program to restore our lives. It is a well of grace we can return to again and again and dip out self-acceptance, self-assurance, and love. Each time we do ACA recovery work, we drink down God's love. We replenish our inner child or true self. We come to believe that God hears our prayers and loves us always. Thank you.
Alison.
Thank you.
It's an amazing. Thank you.
Thank you so much, Alison.
Thank you.
My pleasure. So now, what are your questions?
So I just need to tell the Zoom recorder to end the Zoom recording. I think that was our agreement. So Abby, I believe, if you want to stop.